we're going to explore how hypertension or high blood pressure can lead to a stroke. Imagine your body as a complex network of roads, with your blood vessels acting as the highways. Your heart is the powerful engine that pumps blood, carrying vital oxygen and nutrients to every single part of you. Now, when everything is working smoothly, this system is incredibly efficient. But what happens when the pressure on those highways starts to build up day after day, year after year? That's essentially what hypertension does. Think of it like this. When you inflate a balloon too much, the rubber gets stretched thin and becomes more fragile. Similarly, in hypertension, the constant excessive force of blood against the walls of your arteries can cause them to weaken and become less flexible. Over time, these hardened, narrowed arteries become more susceptible to damage. Now, let's consider what happens when a stroke occurs. A stroke is like a sudden disruption on one of those vital blood highways. There are two main ways this disruption can happen, and both are directly linked to hypertension. The first scenario is an ischemic stroke. This is the most common type. Imagine a traffic jam on your blood highway. Because the arteries are narrowed and hardened by hypertension, it becomes easier for a blood clot to form. This clot can then travel through the bloodstream and get lodged in a smaller artery in the brain, completely blocking the flow of blood. When blood can't reach a part of the brain cells in that area are deprived of oxygen and nutrients, and they begin to die. It's like a vital part of your city suddenly losing its power supply. The second scenario is a hemorrhagic stroke. This happens when a weakened blood vessel stressed by high blood pressure actually bursts. Imagine a pipe under immense pressure finally giving way. This rupture causes bleeding into or around the brain. This bleeding not only deprives the brain of blood flow, but also puts direct pressure on brain tissue, causing damage. It's like a burst water main flooding a neighborhood, causing chaos and destruction. The insidious thing about hypertension is that it often doesn't have obvious symptoms. Many people live with it for years without realizing the silent damage it's doing to their blood vessels. It's like a slow, steady erosion that you don't notice until a significant event occurs. But here's the hopeful part, and this is crucial. Hypertension is often manageable. By understanding the risks and taking proactive steps, we can significantly reduce the chances of a stroke. This involves regular checkups with your doctor to monitor your blood pressure, making healthy lifestyle choices like eating a balanced diet, getting regular physical activity, managing stress, and, if necessary, taking prescribed medications. These actions are like maintaining those blood highways, ensuring they remain clear,